Well, look, let's talk about this right now with someone who, and this is a mad idea when you're talking about something like this, who deals with facts, with data, rather than how people feel about things. Jamie Jenkins is an independent statistician. He's also former head of health analysis at the Office for National Statistics, and he joins us right now. Good morning to you.
Good morning, Julia.
Thank you so much for joining us. I'm sure you've been as frustrated as I've been with all of the questioning we've seen of many of the key figures that we saw. We're not just making decisions at number 10, but also giving those press conferences at number 10, of course, where we've just been seeing the Prime Minister now, but during those periods when we were, many of us locked in our homes, and many very fearful as well, justifying those policies. And so much of the questioning has been about very peripheral things. How did you feel about this? How do you feel about that? And very little focus on the facts, like, did Eat Out to help out? Did it actually lead to an increase in infections and things like that? What do you make, just your general big picture impression of the line of questioning and what we're actually learning from the COVID inquiry so far?
Yeah, I personally think it's an absolute shambles, the COVID inquiry, Julia, because they've set the modules up. The first module was looking at how prepared we were, and now they've gone straight into looking at the decision making. But there's a bit of a gap, I think, and when you got to remember now, the COVID pandemic hit many countries across the world, and they all did different things. So surely the next thing you should do before you start looking at the decision making is to identify where did the UK or England, Wales, Scotland, Northern Ireland, etc., perform better or worse than some other countries. Then look at the decision making that those countries did and the UK did, and then you can start identifying what should we do in another kind of pandemic? So if you take deaths as an example, Julia, there's a lot of discussion around should we have locked down 2 or 3 weeks earlier? Well,
that
Sweden
seems to be the only
at
real
all.
substantive discussion they're having.
Yeah, nothing at all. It's just basically all about lockdowns. I've literally just come onto the show listening to Boris's questioning, and it's all now on the second wave. And did we lock down early enough? Was the country in enough lockdowns? It's all about should we have had enough lockdowns? Well, if you start with the kind of the data, as we just discussed, you look at Sweden, and they didn't have a lockdown. And if you look at excess deaths over the course of the last 2 years, they're one of the lowest in Western Europe. And the point you just raised about Eat Out to help out, Boris is having a grilling this morning. Pretty much the barrister, Hugo Keith, is implying that Eat Out to help out filled those cases in September 2020. But if you look at France, you look at Portugal, didn't have Eat Out to help out. They saw the rises in cases around the same time. And Google data is quite interesting here, Julia. You can track mobile phones and see how much mobility was going on. In August 2020, when the UK had this Eat Out to help out, mobility in the UK was much lower than most of Western Europe. So they're not looking at the real facts.
This is the thing. I don't understand why this inquiry that's supposed to be looking at how we handled the pandemic, why they spend so much time asking about, I mean, they even asked you, Chris Whitty and Patrick Vallance. I mean, shame on them for not saying, look at the data. They, but did you think that Eat Out to help out would actually cause a rise in cases? Well, yes, they both said. I mean, I would expect that it would. Well, I mean, and A, I don't care. It's irrelevant what you thought and what you felt. And B, you don't need to even bother asking that question because we've got the stats here. They're official data. They're not what you think, are they, Jamie? They're not what I think because it fits our analysis of this. They are the objective facts about the situation. And this is the thing I think we all find, anyone who's been paying attention the last few years, we all find very frustrating, is they are so fixated on the, you can do something about a virus idea, even though, of course, we'd been told in advance that you couldn't, that you can stop a virus, that we were fighting this war. Lockdowns are the answer. That locking down sooner or longer or harder or deeper, whatever, will have made more of a difference. But they're having this argument not just back in February, March 2020, not just in autumn 2020, not just in January 2021, not just in December 2021. I mean, it went on for so long. But they're having it even now when we have all the data in. We know what happened in this country and what happened in every other country, and it's not anymore down to what counted as a COVID death, what didn't. The thing that matters is how many more people would have died given any policy than would have died otherwise. And we know the answer because of Sweden. So you mentioned, they've got the lowest excess deaths of the last 3 years, among the lowest, certainly the lowest in Europe, lower than other Nordic countries. So everyone always says, oh, it's very different from Britain. No, lower than other Nordic countries as well. What did they do that we didn't do? Tell us that.
Yeah, well, Denmark was another one that was quite low in the Nordic countries as well. And I think what Sweden did is they just kind of followed the plan that they had in place before the pandemic. So they
Crazy.
pretty much had a plan in place. They followed it to the letter. And there was probably less political influence in terms of what they were going to do. That was the big challenge in the UK. You had, when it was devolved out, because the first lockdown, obviously, you remember, Julia, you had it pretty much being run from the UK, from the centre of Whitehall. But then Boris Johnson gave powers to Nicola Sturgeon, Mark Drakeford. And what you clearly saw then, it was kind of a bidding up of let's bring in more measures. So we saw the WhatsApps, didn't we? That they brought masks in class in Scotland. So they said, well, we better do it in England because we didn't want to be seen to be outplayed by Scotland. So we didn't follow a clear plan. And ultimately, so Sweden didn't have these formal lockdowns. It didn't scare people. There was a reduction in mobility. Obviously, people use a bit of common sense. There's a virus spreading around the world, but it was a marginal reduction in mobility in terms of people moving around compared to the UK. And then what you've got to look at then when we talk about things like excess deaths is the knock-on effect. People were told to stay home, protect the NHS. Yeah. People took that to literally don't bother the NHS. Record waiting lists, lots of misdiagnosis. So the fallout of this, Julia, will go on. And it comes back to what I've said. We've got much, much rich data across the world. We're not looking at it and talking about what Boris Johnson thought or Dominic Cummings about Matt Hancock isn't going to fix problems for the next time. So I think you're top there in terms of what you said, Julia. Let's look and learn from other countries. We've all had the same problem. Who did better? Who did worse? That's what the COVID inquiry should focus on, not
and why that was the case. Because when people said to me, well, look at these countries that didn't lock down, they did badly. Well, no, look at Sweden. Well, look at Brazil. They say it did really badly. And I would say, well, look at Peru. Peru locked down incredibly early. They locked down very strictly. There were about, I think, a month or two where you were not allowed out of your home with people of the opposite sex. I mean, women were allowed out on one day, men on the other day, literally to try and stop people mixing. And again, like you say, the Google data, there is objective data that tells us how much people were actually out and about. It was one of the severest, earliest, longest lockdowns in the world. They have among the very highest COVID deaths. And this suggests to us, doesn't it, some countries that do one policy, some countries do another policy, have completely different rates. We saw, didn't we? Western Europe got hit very early. Eastern Europe, absolutely fine. Eastern Europe got hit massively hard in the second wave. There is an element where, we like to think as human beings that we have all this control, that what we do will really impact things. But actually, as we'd actually been told by the medical experts early on, you can't really do much to control a virus. You could have a 3-week, lockdown, where you just basically stop everybody getting ill at the same time and overwhelming the hospital so you can build up more hospital capacity, which is what we were told we were doing. That was a lie. But you're not going to stop it. And Boris Johnson yesterday, he actually bemoaned at one point, but we kept being hit by wave after wave. Well, of course you were, because if you lock down and people aren't mixing, when they come out, COVID is still there, they're going to get it. I mean, I'm not an epidemiologist and I'm not a statistician. How is it that I can understand that and understood that in 2020 and our sodding Prime Minister and chief scientific advisors and chief medical officers didn't?
No, you're totally spot on there, Julia. And the thing that's very interesting when you do look at the data, and I've written a few blogs on this, is that when we moved into this living with COVID phase, obviously they didn't just switch COVID off. The COVID virus is still out there. And what we saw was we didn't have any new restrictions. We didn't have any further lockdowns. That the virus, cases would go up for 4 to 6 weeks, and then they start coming down again. It was exactly the same pattern as when they were doing all of these measures of bringing in circuit breakers, bringing in lockdown. So the counterfactual is, if we hadn't have done any of this and kind of followed Sweden's approach, would it all have been pretty much the same anyway? And then you've now got all the economic harm off the back of it. So I think you're spot on there, Julia. And you, I think one thing through the pandemic, you did look at the data, the facts you're just talking about there with Eastern Europe.
I tried to make sense of it.
Yeah, totally. Well, the facts you just said, Western Europe got it, then Eastern Europe got it. And we all just got it. Nobody's mentioning China and all this. Just look at China. They pretty much were locking people inside. They then realized they have to unlock. And what happened? The virus started spreading, because all it does is pause the spread. Everybody's going to catch it in the end. And I think basically, Julia, the COVID inquiry needs to learn lessons from other countries, not what did Boris Johnson think about another politician?
And we even had comparisons within the constituent nations of the United Kingdom as well, like on masks and things like that. Jamie, I want you to stay because I want to talk to you a bit more about this. Jamie Jenkins, thanks for staying with us. I wanted to get a bit more time with you. Things that Boris Johnson's been asked about today, about like the fines, £10,000 maximum fine for people breaking COVID rules. A number of people actually paid those fines. For someone who only got a £50 fine for numerous breakings of the rules, he was only end up fined for one. Frankly, that was just a horrible fix. It was a bit rich for him to tell Hugo Keith, the KC for the inquiry, that he thought the fine should have been higher, I thought. He's also been defending he'd had to help out, which we've been talking about. But also, he was asked at one point about why they didn't sort of segregate the society, why they didn't, for the second lockdowns, basically autumn of 2020, why they didn't try and sort of isolate vulnerable people to protect them and allow everyone else to go about their daily lives. This was something that people like you and I were desperately calling for. And we've always had this idea sort of poo-pooed, this idea that the Great Barrington Declaration, Senator Gupta and others called for, which is that all of that money that we spent should have been focused on keeping the most vulnerable people, elderly people, those with health problems safe, while the rest of us got on with it, caught COVID, had it mildly, a couple of days off work and went back to our normal life, providing a blanket actually of health and safety for those people who are vulnerable, surely. Why was that never properly considered, do you think?
It's probably the groupthink mentality that we had within the kind of the SAGE lot that we, Julia, because, you know, I think Carl Hennigan, who's been on the show, obviously, throughout the pandemic with yourself, when he gave evidence at the inquiry, the kind of the barrister who was questioning him at the time, I was quite shocked when I looked at it. He was pretty much trying to do a character assassination on him before he even gave any evidence. And I didn't see any of that going on with other colleagues. Now, when we talk about the vulnerable in society, Julia, the one thing that's quite clear, I think, when you're looking at the decisions that were made, was the discharge from hospital into care homes. That was obscene when you look at it at face value, because one of the things when we do track the data through the pandemic is that we do often find a lot of people in hospital who have tested positive for COVID, but they're not actually in hospital because of it.
It's just everyone's been tested, so you're going to find it.
And so earlier on in the pandemic, when we didn't have the testing capacity, so it's probably, you did have many older people who had the virus, didn't feel ill with it, because it does vary in terms of your kind of underlying health conditions, discharged into care homes. And then the impact of that, Julia, obviously is probably seen these large number of deaths in care homes. But when you look at it on face value, we knew quite early on then, especially when we went into the winter where they were starting to lock down the whole country, in terms of who was at the most risk to this. So continuing and paying more furlough money when pretty much, you know, Sweden had got it right, as we discussed earlier on, continuing to pay more and more money out, costing the Treasury a lot of money. I think we should have probably definitely done this more targeted approach. Now, the government would argue that that is also a difficult one to just protect the vulnerable, because they need care workers to go in. And unless care workers actually live in the care homes, because they obviously
they've got children and families, they go on the bus.
Yeah, so that's always going to be a difficult one to do. But I think we clearly knew closing schools or putting masks in class and all those kind of things, they could have really chosen not to have affected that side of the population and then looked at targeted measures for the more vulnerable.
Exactly, they knew. Everyone always says, most frustrating thing is people say, well, we didn't know it didn't, it wasn't a risk to children. No, you did. We knew that in February 2020. Absolute nonsense. We absolutely knew. Chris Whitty and Valence are on the record saying that. It's very clear in the stats. And again, one of the most shocking stats I've seen is when you look at healthy children, look, sadly, children who had some health vulnerabilities, cancer and the like, did die with COVID or of COVID. And every death of a child is obscene, absolutely horrible, horrible thing to happen. I'm not being glib about it at all. But in terms of healthy children, otherwise going about living their lives, more children in the first lockdown in 2020 died from excess domestic violence, having been locked in their homes with their abusive parents, than died of COVID. And that, that is a fact that should be more widely known. But look, you know the stats as well as I do. We are mid-table. What the UK did, Scotland has various different policies, pretty much the same sort of death rate as us. We had a lot of the same policies, looking down at roughly, same sort of wave, same sort of time as a lot of other countries. Some had higher death tolls, some had lower death tolls. A lot of it will be down to how, the family existence, whether people have elderly people living in their homes or not, whether they're living in more sort of nuclear families, whether you have more of an ageing population. We know Africa, really massively different outcomes because, of course, not an ageing population. Whether you had a fat population, whether you'd had a particularly hard winter in 2019 or not, massive impact on the death toll in spring of 2020. There's so much that is there, that is in the stats that explain an awful lot of the differences. None of this is getting a look in.
No, and all those points you just raised are the pertinent points that the COVID inquiry should be considering, Julia. You're kind of spot on in terms of your kind of summation of all of that. And that, to me, is going to be the biggest travesty, because remember, we're going to have to wait years and years before we get any findings from this. And what's surprising to me is, you know, when you watch the videos, I think you've got Boris giving evidence there, but when they kind of pan around to the KC, the amount of people in the room as well, and what are they doing?
We're paying for all of them. Jamie, we're paying for all of them. Listen, Jamie, it's such a great thing to talk to you. Thank you so much. You've been fantastic throughout this period. Jamie Jenkins, independent statistician, used to be at the Office for National Statistics.